Time for Riv-Fur City Pets, and today is a really important topic. It's all about first aid for your pets. I'd like to welcome back Dr. Mike with 6th Street Vet. Welcome back, and we have a special guest, Mojo. So I'm extremely excited to do this segment because Mojo is already bringing a lot of personality and a lot of fun. But again, this is such an important thing because pets like us are prone to accidents. Cuts, scrapes, insect bites, we see a lot of that right now. So what are some things we could do to really assess our pets and make sure that they are okay?
Well, I think, the first thing is you know your pet better than anybody else. So just look at him. Does he look really weak, like he can't get up, can't walk around, or, is he walking around pretty normal? And then when you look at your pet, one of the things that you can look at, we look at gum color. So Mojo's really excited, so he's kind of nice and bright pink. But when we look at these gums, if those gums are white or blue or gray in color, then, that's a warning sign. You really want to be thinking, okay, there's really a problem here. You can feel their heart, and count a heart rate. Normal rate for a dog might be anywhere from 70 or 80 up to 150.
I would imagine the size of the dog would be totally different.
Exactly,
right?
Yeah, smaller animals. But, if you do that on a regular basis, you'll know what's normal for your pet.
And back to the gums, because I haven't heard of that before. What's a baseline? I know you said that Mojo's excited, so pink right now, but what's a baseline?
You want pink. They should be pink like our gums, and we also, you can press on the gums and make them blanch out white and count how many seconds till they come pink again. Normal would be probably 1 to 2.5 seconds. If you put a finger on that and 4 seconds, 5 seconds later, there's still a white thumbprint.
Right.
Wow, that could be a blood pressure problem, dehydration, shock. Those are some of the things you want to look at. And with a wound, do they just have a little cut or is it bleeding really profusely? You want to always kind of look at all that overall situation and try to see if it's something that you think you might handle at home or if you're going to need some veterinary attention.
Now, what about something like the gait of the dog as far as their movement or something like that? A lot of times that happens. They might sit on it wrong, sleep on it, and you don't know, is it something serious or not? What are we looking for with that, with joints and things like that? Generally
speaking, if they have what we call a non-weight-bearing lameness, where they're carrying a limb and not using it at all, then that's something you're going to want to get checked out. If you just notice them gimpy a little bit, when they first get up in the morning, that's something you're going to go address with your regular veterinarian, not on an emergency basis.
Sure. And then what are some mistakes that you see in your practice that people make time and time again?
Probably one of the biggest ones we deal with is people, their dog is hurt, they're not sure, maybe they're trying to wait a day before they go to a veterinarian, and giving over-the-counter pain relievers. You have to really be careful with over-the-counter pain medications, and what I tell people at my practice is dogs are not small people, and so some things they may take may be a common medication like Benadryl. Other things such as Aleve or Tylenol, those can be very poisonous to pets.
Sure.
You always want to call first and check before you ever give anything at home, and I don't care if on the internet they said it's okay.
Right, yeah. So that's a good tip right there. Internet, that's not your source of information. Now let's talk about this. When is it time to bring your pet to the hospital?
I think any time that they are extremely weak or lethargic, if they're not getting up and moving around, there's a problem. I think that if they haven't had anything to eat or drink for 24 hours, if they've been profusely vomiting for more than 24 hours, anytime they have difficulty breathing, anytime they have seizures, and also any bleeding from any place that's not stopping,
right,
or trauma. If they've been hit by a car, they need to go get checked out.
Well, Dr. Mike, thanks again. Lots of great information, so important. I think really the big thing is be proactive. If you have a question, have a vet, and then contact your vet. So for more information on your practice, 6th Street Vet, you can call 904-259-2200, or you can go to the website, 6thstreetvet.com. And thanks, Mojo. Good job. Stick around. More River City Live coming up right after this.